Irile mo boshele lephata la botsogo le tshwaraganye le Botswana Public Health Institute ba tshwara graduation ya ntlha e le ya go alosa dialogane tse e leng gore le tsone ke tsa ntlha mo go tsa botsogo jwa setšhaba. Nka mogele mo thulaganyo ya Around the District tla re utlwa mafoko a go bulela tiro e ya go alosa ga mmogo le go utlwa maikelelo a one mo letlong.
Today, we gather not only to celebrate the achievements of these dedicated public health professionals, but also to reaffirm our collective commitment to safeguard the health of our nation. This ceremony is a testament of Botswana's unwavering commitment to strengthening the health system. The FETP program, revitalized in 2022 through the collaborative efforts of the Ministry of Health, Botswana Public Health Institute, the U.S. Centers of Disease Control and Prevention, which is CDC, and the African Field Epidemiology Network, AFINET. It has become a cornerstone of our preparedness against disease threats, and these graduates represent the frontline defenders who will ensure early detection, rapid response, and mitigation of outbreaks wherever they may arise. The significance of today's graduation extends beyond certificates. It reflects decentralized excellence. With health services now under the Ministry of Local Governments and Traditional Affairs, these graduates will empower district councils to lead localized responses, ensuring that no community is left vulnerable. Let us celebrate this milestone with pride, but also with a renewed sense of purpose. The challenges ahead demand vigilance, innovations, and unity. As we honor these graduates, let us recommit to supporting the mission because their success is Botswana's success. Thank you for your presence today and have a very good morning. Pula.
Dialogane tsa gompieno di a go thusa thata ko dikgaolong gore setšhaba se fitlhelele ditlamelo tsa botsogo gongwe le gongwe ko ba leng teng. Tla re utlwe molaetsa go tswa go ba lefatshe la Amerika.
For 12 years, the United States government has been proud to support the Field Epidemiology Training Program in Botswana through the U.S. Centers for Disease Control and Prevention. This program supports the government of Botswana's efforts to strengthen the public health system to better prevent, detect, and respond to infectious disease threats when they occur. Human resources are a critical component of the public health system's ability to address threats. With funding from the U.S. government, the U.S. CDC has been in a position to work with all of the wonderful partners you see represented here today, precisely to train public health workers and improve their capacity to respond to public health threats. Close to 250 field epidemiologists have already been trained through the FETP in Botswana, and they've gone on to contribute immensely to public health. You, the fourth cohort, represent an additional 15 graduates ready to join this important work. It's difficult to think of something that a successful country needs more than a successful public health system. It is therefore encouraging to witness the constant progress that Botswana has made in this area. For quite a few years now, the United States has been proud to support that progress through the U.S. President's Emergency Plan for AIDS Relief, PEPFAR, and other programs. The point is, in Botswana, there is a structure in place to monitor dangerous diseases and to mitigate their potentially disastrous effects. And graduates, you are now part of that structure. What honorable work you've chosen. Not everyone is lucky enough to wake up every day with confidence that the work they do is of tremendous service to their family, to their neighbors, to their nation, and ultimately to the world. Congratulations once again for your decision to choose this work, your dedication in reaching graduation day, and for the promise of your value to your fellow human beings throughout your career. I know I speak for all of us when I wish you great success and great satisfaction in your work. Thank you very much.
lefatshe la America le na le dingwaga di le 12 le ntse le menokeng lefatshe la rona la Botswana fa re bua ka dikgang tsa go nonotsha botsogo mo tšhabeng ya Botswana. Se ke maiteko fela a mantle. E ke nako ya go utlwa molaetsa mogolo wa kaloso e go tswa go mothusa tona wa lephata la botsogo Re Lawrence Okeditse.
Director of Ceremonies, I want to express my pride and honor in being able to stand in front of very smart people. One of the downsides to doing the job that we do is you also have quite, you need to have the patience to spend a lot of time in discussions that are not quite going anywhere. But then the upside is when you come in and you address and listen to people like yourselves who are very intelligent and who are going to quite challenge your capacity. So I am happy to be here this morning as we're looking at enjoying and unleashing the fourth cohort of the Frontline Epidemiology Training Program under the theme Guardians of Public Health, Equipping Botswana with Disease Detectives for the Future. It is an achievement that underscores our government's unwavering commitment to building a resilient healthcare system capable of confronting new and emerging threats. It is also testimony of the commitment of our partners in ensuring that we build a healthcare system that works for Botswana. And David, you would have seen from the presentation earlier on that the impact of this support from our partners is real. When they were presenting their statistics, you could easily tell that without the support that we're getting from our partners, we are not quite able to detect a lot of what we must be detecting. And then the numbers may come out as though they are falling, while they're not actually falling. It is just a case of us not being able to invest enough in detecting cases and even providing program support. So I think if there is anyone who has done quite a great deal of showing how important your support has been to our programs, it is them, and we should give them a round of applause for doing such a good job. Ladies and gentlemen, the frequent occurrence of disease outbreaks and the emergence of numerous public health events that the continent has been experiencing recently call for us to continuously enhance our competencies of public health professionals in essential field epidemiology practices so as to better predict, prevent, control, and protect our people from disease and public health events. Allow me to echo the timeless wisdom of Dr. Alexander Lengwe, the visionary founder of the CDC's Epidemic Intelligence Service, who profoundly declared, and I quote, "The goal of field epidemiology is not just to count cases, but to prevent them." His words resonate deeply with our mission here today, because what we are doing here with the field epidemiologist is to basically produce what are often unsung guardians of our public health, the vigilant foot soldiers who stand between our communities and the relentless threat of outbreaks. True field epidemiology, therefore, transcends mere disease tracking. It is not just about going out to count the cases, but it is about an unwavering commitment to ensuring that we are committed to the science of foresight, the art of transforming raw data into decisive action, and uncertainty into unwavering preparedness. It is about action that prevents disease in the first place. And this is the essence of the work we are honoring here today. It is primarily for that reason that the Ministry of Health, in collaboration with CDC Botswana Atlanta, as well as AFINET, saw the need to resuscitate and revamp the FATP in Botswana. This program commenced in July 2022 and has so far yielded 73 graduates across all levels of the health system, including districts and city councils.
Mothusa-tona wa lephata la botsogo a galeletsa batsayakarolo mo go thuseng lephata la gagwe go nonotsha dikitso tsa boitseanape mo lephateng la gagwe. A re dialogane di ya go sireletsa le go boloka matshelo a tšhaba ya Botswana, ka jalo a le motlotlo fela thata ka se. Tla re utlwe mongwe wa dialogane a kgakgaba dibui tse di sa tswang go ba galeletsa mo kalogong e.
On behalf of Cohort 4 Frontline Field Epidemiology Training Program graduates, I stand before you as their team leader to express my sincere gratitude and a deep sense of accomplishment for what we did. I believe the moment that we've been waiting for is nigh, and I'm honored to express sincere appreciation to all those who have been a part of this journey. That is the government of Botswana, the US government, CDC, AFINET, BPHI, and WHO for their unwavering support. It is through their dedication and the dedication of their facilitators that we have reached this moment. And I would like to share a story before we go any further. I came across a story recently of a man who had a son who put the world together. The story goes like this. There was a man who had a son he loved very much, and he would spend his time every evening playing with his boy. One day, whilst he was at work, he realized that he would not have enough time to go play with his boy. Over in one of the tables, on one of the tables, he saw a magazine with the map of the world. He took that out. He tore it to pieces and put the pieces in his pocket. And he carried that home with him. When he got home, the son, as usual, came running towards his father. Daddy, can we play together? Knowing that he had some extra work to do, he gave out the pieces to the son and told him, this is the map of the world. Put it together. He gave also the scotch tape for him to stick the map as he's putting it back together. I believe the boy had an analytical mind of a field epidemiologist, because the father had thought it would take him hours, but in no time, less than 30 minutes, the boy had put the map of the world together. The father exclaimed, "How did you do it?" The son said, "It was simple. I fixed the man." There was a picture of a man behind the map. And when I fixed the man, the world came together. I believe this is a clarion call to us who sit here today that fix the man. The Ministry of Health will come together. Fix the man, Botswana will function. Fix the man, you graduates, and surveillance will work out. Fix the man, and everything else that you've ever dreamed of in the world of data will pan out.
mongwe wa dialogane a leboga botlhe ba ba tsereng karolo mo ithutuntshong le go aloga ga bone mo mafokong a gagwe go tlhalositse fa e le dialogane ba go dira ka natla go tsosolosa serodumo sa botsogo jwa setšhaba mo lehatsheng la rona la Botswana. Tla re tswalele thulaganyo ya rona ka go utlwa lefoko go tswa go go ba BPHI. A re kopane gape nako e tlang ke re filwe tao.
To the Ministry of Health, Ministry of Local Government and Traditional Affairs, your leadership in decentralizing health services and embedding our FETP graduates across all your districts ensures that our defenses against diseases are both agile and robust. To us and to the nation, this is health equity in action. As we close, ladies and gentlemen, let us reaffirm our collective mission. That is to build a Botswana where no outbreak goes undetected, no health threat is met with unpreparedness, and no community is left vulnerable. The road ahead demands vigilance, innovation, and unyielding collaboration. But with graduates like yourselves and our partners in the room, I have no doubt that Botswana's public health future is in safer hands. Congratulations, Cohort 4. A round of applause for these ladies and gentlemen. This new title of Disease Detectives, please wear it with pride. As you stepped on this podium today, I could see the pride shining through. Wear it with purpose as you go back to your field, and let it guide you to safeguard the health of our nation. Ke la kgole le bonatla le botswerere jo le bosupileng le tswelele hela jalo mo ditirong le mo matshelong a lona. My minister could not have expressed our gratitude any better than we could have. Thank you to all our dignitaries, our speakers, our graduates, our partners for gracing this important ceremony with your presence and your kind and very important words. Now, ladies and gentlemen, let us go and fix the man. Apula elinele. Thank you.